I thought that what was most troubling on that list was a $200 million for a new state house. Clearly, that was something that was totally out of line and really was an extreme abuse of power, in my opinion, to think that using $200 million of federal funds that are meant to go to this public health crisis, which has caused an economic crisis.
In the next bill, the coronavirus bill that Congress is considering, is there something that you want to see put in there so that state legislatures like in Alabama can't take the federal funding and kind of have so much leeway with where it can go to things that, like you said, are not directly related to coronavirus and relief?
Absolutely. I think that you will see in this next package more targeted, directed funding for local counties and cities. And I have been a leading voice on that because I think it's critically important. We've seen states across this nation not prioritize providing a fund of some sort within the state so that truly local cities and municipalities, towns and counties have access to some of this federal resource. And the intent was that the states would provide a statewide coordinated effort when it comes to testing, treatment, and tracing, but also provide leadership when it comes to providing a supply chain for PPE, not just to our hospitals and our nursing homes, but to local health providers as well. And we are not seeing that leadership from the state of Alabama thus far. I'm going to, always an eternal optimist, and I would hope that given this pushback that you've seen in the public on things like this building a new state house, that our state legislators will go back to the drawing board and really come up with a plan that first and foremost prioritizes the public health risk that we're all taking by opening back up our economy. I agree that all of us are stir crazy right now and would like to get out and about, but I know that I represent a disproportionate amount of the truly vulnerable communities and at-risk communities. And my advice to them is to be their own best public health advocate, that our government is not prioritizing their public health, but we have to prioritize our own public health, that we have to see that to the extent possible, we should continue to stay at home, that we have to limit our exposure on the outside to truly essential things that we need and essential activities, that we should wear our facial coverings to the extent possible, and that we should mandate that our workplaces have extraordinary provide extraordinary efforts to provide that PPE, the public safety equipment that employees need, hand sanitizers, and and really provide that our customer base wear the facial coverings that they need. So I will, in the next bill, be prioritizing direct assistance to our counties and our cities. I'd like to see also more money for our relief fund for medical healthcare professionals, our federally qualified health centers, our community health centers, our hospitals, our nursing homes. We clearly need to fight on they provide additional resources to fight on the front lines against this public health crisis. I'd also like to see more resources that are directed towards our frontline workers. Hazard pay would be something that I'm fighting for in this next bill. I think that they're the true heroes here when we think of our frontline healthcare professionals and our essential workers, those in our grocery stores, those in our law enforcement, our firefighters, and definitely our postal workers are included in that, and they have been left out. And I think that their inclusion in this next package will be essential. I'd also like my colleagues on the other side of the aisle to join us in our efforts. Right now, this bill is a big and bold bill that reflects the values that Democrats have, but I also know that they are the values that all Americans have.